Hi, everybody. This is your Weight and Goal Wellness YouTube, and I'm Dr. Leslie Golden, and I have Natalie Ross here with me. She's one of our incredible clinicians. She's a nurse practitioner at Weight and Gold, and she's been with us for quite a while. How
Mhm.
long has it been, Natalie? And
Yeah, almost 2 years actually. Time flies.
yeah, right. Well, why don't you introduce yourself to everybody and explain a little bit how you got into obesity care and what you love about it?
Okay. Well, thank you so much for making time for the discussion today. I actually worked in the women's health space for about 8 years and was seeing a lot of chronic disease that was really impacting women across their lifespan. So, whether it be polycystic ovarian syndrome, so PCOS, or menopausal issues, or even, some types of cancers related to, and it all kind of came back to a lot of the lifestyle and a lot of their concerns around their weight health. And so it got me curious. And, when I was in school for to become a nurse practitioner, we didn't really learn a lot about all of the weight health and obesity care that is now really, I think, a standard that we should all have exposure to and learn about. But so I kind of got curious and I logged on to a session through the American Academy of Nurse Practitioners, and they had this boot camp for obesity and obesity care. And after the first session, it was 8 sessions, I was like, this just like blew my mind. It was all about the pathophysiology, and I was blown away. So I was like, you know what? I need to do better for my patients. Like I feel like I'm not giving them all of the information that they deserve and that they need to make decisions about their health. So I did the boot camp, and then I got more curious about it because again, it's so complicated. That took me to the Obesity Medicine Association, where I was able to do, they have a 60 credit certification for advanced practice providers. So I did that over the course of about a year. But while I was doing that, I started bringing aspects of obesity care into my women's health practice, and it took off. And it was like, my day went from being 100% women's health issues to being about 90% obesity care and about 10% women's health, although it's also related, that it really it really meshed nicely. And truthfully, I felt like that just gave me this huge sense of fulfillment and purpose, and was able to really make a difference for a lot of people that I cared about and cared for. So, but I also wanted to do better again. And so one of the things that I learned very quickly is this is a team sport, and having supportive resources, so having health coaches, dietitians, people that can help me on the insurance side to understand the prior authorization process, which is very complicated to say the least. And
Yeah.
I didn't really have those resources in a women's health space to be able to offer again the quality of care that I wanted to be able to offer patients. And so then I found Weight and Gold, and it was a perfect marriage of all of the things that I value in the care for patients. And so that's what got me and brought me to the space.
That's quite a journey. I think you really highlight how complex this is. I feel like a lot of you don't know what you don't know, I think, as
Hmm.
a clinician. And I remember being there, and it sounds like you remember being there in terms of we knew we needed to figure out how to help patients with this condition. And then maybe it would just be a short training and be able to just add that on. And once you realize how much science there is out there about obesity and the layers, like the phenotypes and the different pathways, and oh, by the way, the body keeps fighting back, and oh, it can get challenging at different parts of your life, and you may need different treatments at different parts of your life. Like, you start to realize that, and it's not just a weekend course, and I've got this covered for all patients.
Yes, that is so true. And I think that's I mean, we're all lifelong learners in this space, and I think that's really an important part of as this field continues to evolve. what we knew 2 years ago, or what we even knew, sometimes with the medications 2 months ago, has changed so much. And I really like that, because it's a practice. So that means, right, we're learning, we're evolving, we're growing in this space. And um, I really feel like, going to conferences, networking with colleagues, learning about how other providers and other clinics help support patients helps us all grow in the field. And that's really the only way we're going to advance it. And there's been a lot of work in that. So I'm pretty proud of the work we do at Weight and Gold, because really being leaders in the space.
And we bring a lot of hope to so many people with it. It's like the medicine
Mhm.
of hope, and it's happy medicine for the most part, except for those prior authorizations. They don't make many of us happy, but
They do not. They do
yeah.
not. But even, and speaking of hope, thinking about how it's even changed. So it's been about 4 years since I really like dove into the obesity medicine, and really the care that is a part of it. And I think about what medications we had available even 4 years ago, and like what they look like now. It's not a perfect world, but it's a world that's really improved a lot in terms of access for patients. I have that conversation often, because people will come in. Even just yesterday, I was talking to a patient. She's like, "Yeah, I mean, I know those medications, they're $1,200." And so, like, we were talking about some of the
Mhm.
injectable medications. And I'm like, "Well, actually, can I," I let her finish, and I'm like, let's talk about that, because she was re-engaging in care after a little bit of time away. And I was telling her how that's actually been a good change, that these have come down in price. Still a cost, of course, but really thinking about the value in this particular patient that it can add to her life and what her goals are. So I think, that is also hopeful as we look to the future and there's new therapies emerging. What sort of treatments are we going to have? What better tools are we going to continue to be able to offer our patients as we, work to understand and help treat this disease?
Mhm. It just the education and the advocacy, right? And I think sometimes with this space, because you were talking about, like, growth as a field and as providers, in a lot of ways, our patients and our community have had to grow in their understanding of obesity and their
Mhm.
understanding of weight, right? Because this diet culture history of it's simple, eat less, move
Move
more. It's
forward.
just a math equation. And once you get that math balance, your body should respond. And if your body doesn't respond, it's not it's you're doing it wrong, right?
Mhm.
And that's what we've been told for so long. And I think that's what's been so amazing about learning about the obesity science is where that's not accurate. It's oversimplified. It's so much more complicated, but then so many of our patients don't understand that, right? And they're also getting mixed messages from social media, from
Mhm.
providers that aren't educated yet on this. And so what do you wish our patients and just those living with obesity and the people that love and take care of them, what do you wish all of those people understood and how they could grow?
Yeah, great question. I think my biggest hope for our patients, or for the individuals living with obesity, is that we really look at it as a chronic disease. And so, we're familiar, right, with diabetes, with hypertension, with high cholesterol. Those in our brain. Many people understand those as requiring lifelong treatment. That doesn't necessarily always mean medication or pharmacotherapy, but requiring some lifelong treatment. And so, what I always like to tell patients is, we're really running or walking, or we're in a marathon, right? We're not in a sprint. So that doesn't mean that, what you need now is what you're going to need in 5 years from now. I don't know what you're going to need in 5 years from now, but I will be here in 5 years from now, God willing, right? To be able to help support you where you're at in that time. And because I think, right, we are as a society, a very, like, we want action, we want results, we want things quick. I mean, that's the world we live in. but our body isn't really meant to do that. Our body is meant to adapt and change slowly over time. So I think there's kind of two things, right? Understanding that this chronic disease is treatable. We're here to support. It's complicated. Nobody ever said it was simple. Well, people have said it's simple, but they're wrong. It's not simple,
Mhm.
right?
Right.
But then also along that same idea and that same thought is that we are here for wherever you're at in that journey, and it's okay for that to look different depending on where you're at in your life. And so one of the things I'm really proud of about us as a team is we meet people where they're at first and foremost, but then also we individualize our treatments based on where they are, maybe at a stage in life, or a goal they have for their health that's maybe more time specific, like a specific surgery they need to have, or if they're trying to conceive. We adapt those treatment plans to the needs of our patients, because we can have guidelines and parameters, of course, but that doesn't it's an individualized approach to care, which is
Mhm.
really important.
Right, because it's a human that's sitting there in
Right, right,
conversation with us, right,
right,
And I
right.
think that's what people forget, and I think some of the visits that I get the most out of, um, you know, emotionally, and I feel like I've had so much of an impact, or my conversation with the patients that are going through grief, that are going through like a job loss or a loss of a loved one, or just high stress or the end of a relationship. And for them to hear me as the weight loss doctor to say, I don't think we should be focusing on losing weight right now,
Mhm,
that we need to focus on self-care, and this is not a time, like, giving them permission to, yes, take care of yourself right
mhm,
now, but that doesn't mean trying to continue to change your body right now.
mhm.
Do you have those conversations with patients at times?
I do, and I think along those lines, my some of my favorite conversations with patients are the ones who come in really frustrated because, or really upset with themselves because maybe they didn't meet a weight goal, right? Like, oh, I wanted to be, 200 pounds by this visit, and I'm 202, and like that whole idea of that failure, you can see it playing in
Mhm.
their head, right? And then we dive in deeper. Maybe we do a body comp scan on them, or maybe we talk about, okay, what's been happening since your last visit? And then maybe I'll find out, or they'll share, well, I just, walked a mile and I'd never done that before. Or I have so much more energy. I'm able to play at the park with my kids. Or my jeans are fitting better. Maybe I pulled out some clothes I haven't worn in 5 years. And I love those opportunities to be able to interject and help them maybe in their own minds recognize those are huge measures of success that are so much more important than a number on the scale. It's really about how they're feeling in that in those victories. And I think as a society, again, weight and a number, a lot of people have that number in their brain of like, I have to get to this number. But when we dive deeper, it's usually not the number. It's usually something that was happening in their life at that time that they want to reconnect with. And so being able to understand that and really, it's really a privilege when patients open up and share those experiences, because then we can kind of help work with them, to navigate maybe other ways to find those same feelings.
I've seen that come forward in so many patients too, when I can get to that moment where they're
Mhm,
sharing, like you're talking about, of asking, sometimes I'll ask something like, if you felt like, what is that day? What does success look like to you? And
mhm,
not the number, but what do you envision yourself doing that day? What does that life look like, right?
mhm,
And when they're able to create that, I like to say, okay, what if you have that now? What if you had that now, but that number on the scale was still the same? In trying to separate that, and it starts to
mhm,
build that process for them of separating, like, oh. am I assigning a number? What meaning and value am I giving
Mhm.
to that number in
Mhm.
what you're describing, right? And very often I've heard people say everyone wants to be the age they were, like 18 to 22 years of
Mhm.
age, right?
Mhm.
And a lot of that has to do with, we had lots of energy. We weren't as overwhelmed by so many things in life, and it's that value that we assign to that number having, and we have to help patients work towards that,
Mhm.
which is a part of that above the neck work in
Mhm.
obesity care, right? And I love how you
Definitely.
highlighted all those wins. People will call them like non-scale victories, off the scale wins, different things like that, and really highlighting weight independent goals, right?
Mhm.
Because I think what a lot of people have an opportunity to continue to get used to is that obesity treatment and obesity care isn't actually focused on weight loss.
Mhm.
And I think when we have those initial conversations, it it can be confusing for many of us, because even myself, I have to
Mhm.
remind myself too, right? Okay, they're not losing weight. It still happens, right? Oh, they're not losing weight, but their blood pressure's better. They're sleeping better. They weren't out of breath going up the stairs. So reminding ourselves that yes, there does need to be a shift in the health of the adipose tissue, fat tissue, right?
Mhm.
But that doesn't always show up in that scale number.
Right. Right. Absolutely. And helping guide individuals where they're at in that journey, because I mean, how many our whole medical world, right? What happens when you go to see your healthcare provider? What you step on the
Step on the
scale
scale.
as a part of your visit. I mean, pretty much across I was at
Mm.
I can't even remember. I was at an appointment the other day, and I'm like, it had nothing to do with weight at all, but that's the first thing they did. And I,
They need it for
again,
that ear infection,
that's
right?
right. Exactly, exactly. But I also think that's a good part of our clinic, right? Is that we don't require patients to be weighed. Now, sometimes with insurance requirements, depending on what's going on for them. But, I've had several patients that either don't want to step on the scale, or are, like they don't want that information because, again, they've kind of transitioned into this process where it doesn't, the scale number is not the value they're looking for. It's the other values in their life. And so I think respecting that is a really important thing that we can do as well to help create a supportive environment for our patients.
Mhm. And I think a part of that conversation too, and interested to hear your thoughts on this, because I know you're passionate and have a lot of interest in movement, in that
Mm-hmm.
part of things. And when we look at that, I think one of the barriers that we see and can be reinforced by only looking at the scale is this idea that because I'm in a small body or a smaller body, I'm automatically having success. Uh, and that may not be the case, right? Because if my movement and my activity, if my muscle development isn't there, so we see the issue with the scale give us false information if that's all we're looking at on the whole spectrum.
Right, right, right. Yeah, this is an area that I am very passionate about. Is really the idea of longevity and aging. Right, we're all aging. The alternative is not good. So aging is what we want to do, and thinking about how our activity now can help us 2 years from now, 5 years from now, 10 years from now. And really, truly, for women, if we're not intentional and remain active or start engaging in activity, and including resistance training, we are likely going to be losing about 8% of our muscle mass per decade. So I flash that forward in my brain. So my mom is aging, and her and I have these conversations all the time. She grew up in a very heavy diet culture where being thin was like super important, and thankfully, that was something that, she really talked to us about, is accepting and loving our body at any size. And I'm
Wonderful.
so grateful for that. But she did not grow up in that culture. And so watching her, though, we have these great conversations about staying active, and she walks every day, and she is starting to do some strength training, never done it before in her life, but understanding like how important being able to get up from a chair, open the door, carry your groceries. Those are all things that are going to help us as we age. And so making that transition again to maybe our patients in their 20s and 30s that may be at a different phase, but helping them understand like this is the time in your life where it's really important if you haven't been physically active, let's start that. It doesn't have to be, you go out and run 3 miles, but maybe it's I start walking 15 minutes a day on my lunch break, or maybe, I start doing some body weight exercises at home before, I start my day. Another thing, separately but equally important is the mental health benefits from physical
Mhm.
activity, with it
Not
being
talked
mental
about
health
enough, right?
awareness. Yeah,
Mhm.
like, I mean, think about how you feel after, you finish a walk. Or yesterday I went walking in the morning, and like the sun was coming up, and I'm just like, it was just a beautiful sunrise, and that really set the tone for the rest of my day in terms of my mood and how I attack or approach the day. And so I think helping patients understand too, the physical benefits have been well documented, well studied, but the mental health benefits are really, really significant as well.
Mhm.
And I think it's something that we can continue to advocate for, and really share that message.
Yeah, I think that is so important. I see that all the time in terms of, I'm fatigued, I don't feel good, I'm in pain, I'm stiff. But if we can just get ourselves to move a little bit more, we usually do feel better afterwards, and just getting
Mhm.
ourselves there, can be the difficult part.
Mhm. I talk to my patients about the 5-minute rule, and
Mhm.
I don't know if you've heard of that before, but like you give yourself 5 minutes. So you say, I'm going to do this activity, right? And whatever it is for 5 minutes. And at the end of 5 minutes, if I want to stop, I'm giving myself permission to do that. But many times, once we get started and we get going, we don't want to stop because it really does feel good. And that I think is also important to remember and distinguish. Physical activity and movement torture. We should really find those things that we like to do or that feel good in our body. I may want to go running, but if running doesn't feel good in my body, that's okay. Like my body does a lot for me, and I'm going to do something that makes it feel good when I'm doing it. It can still feel hard or challenging, but it should feel good and not torture.
Right. Yeah, it's not a punishment, it's
Right.
not another obligation, it should create some joy, or try to find a way to make it joyful. Can you bring a friend along? Can you listen to your favorite podcast, to make it, more of a positive experience if you can't play your favorite sport at that time.
Mhm.
And, I think that's so important. I know, someone shared the other day that their care provider kind of told them that gardening and working out in the yard isn't really exercise, right?
Mm.
And I think that's such an opportunity for us to help people reframe, that any movement with your body is movement with your body. It
Mhm.
counts. This idea of unless you're in the gym on the treadmill, it doesn't count, is not helpful, for patients, because then we may have someone that is very active doing something they love, and maybe they'll stop that because they think they have to be on the treadmill for 60 minutes in the gym, and that makes them miserable.
Mhm. And then that builds resentment, and then that
Mhm.
builds, right, that whole cycle. I've actually heard the opposite where, you like, I would rather have somebody that is moving non-exercise activity throughout the day, versus somebody who maybe goes to the gym, hits it hard for 30 minutes, and then is very sedentary the rest of the day.
Mhm.
Like that flipping that narrative of really like the sustained movement throughout the day, or more regular movement throughout the day is actually more beneficial. I know that might be a little controversial, but I think that that's something that, certainly from an energy expenditure and an output expenditure, we can see that.
Mhm.
So again, just helping people find what brings them joy, because that ties into all of it, right? If we like to do it and we find joy and purpose in doing it, we're going to be more likely to continue it, and that's really
Mhm.
the goal.
Look at the new pickleball sensation, right?
Oh,
We have
I
so many
know.
people playing pickleball for the first time, and now they're playing it like 5 times a week.
I
So
know. Have you played ever?
I have not. I'm a little
Me
scared.
neither.
I'm a
Oh,
little
I
scared to get addicted to it.
I know. I always will have friends text me and be like, "Hey, can you join us today?" And I'm like, "Sorry, gotta work, but it's okay. Have fun," like,
Yeah,
but yeah,
I'll
I'm
put it on my
curious.
list.
It's all the rage, definitely, for sure.
Right.
Yeah.
Well, one thing you mentioned earlier I wanted to come back to, is you were having that conversation with the patient about access and availability and, what treatment would look like for them, and it reminds me of a lot of these value conversations that we have
Mhm,
for patients. I find it interesting, being a previously in primary care myself, um, it seems unique to our field in helping people with obesity and appetite regulation that we're often having to convince them of the value of the medications, right? That it is worth, if you're
mhm,
able, um, to invest in treatment. I feel like previously, if someone needed a very expensive med for MS, or for different liver diseases, or for resistant seizure diseases, where we had to start escalating therapy, or heart disease, diabetes, convincing them, we all would love for them to be cheaper, but convincing patients of this is really important and we got to find a way to make this
mhm,
happen wasn't hard. But with obesity, I find that we often have to help our patients give themselves permission to treat this.
mhm.
I think that kind of goes back to that internalized weight bias and stigma, and helping patients understand it's not their fault. What are your thoughts on that, in those conversations, and in helping patients see the similarities there
Mhm.
to other diseases?
Yes. So that is really really a lot, right? A lot to unpack, a lot to think about. I feel like I've really sort of evolved in my thought process with this, over the past few years, and I think one of the things that, if I could, hypothesize why I think people struggle with that, the value and giving themselves permission, right, to think about the value of some of these medications. I think it might also stem from a place. Most people come to us having tried, I don't even know, at least 10 to 15 different diets
Mhm.
and, nutritional plans, whatever that looks like. And some of them probably pretty costly. Like when we dive into some of this, I'm like, wow, they've spent a lot of money and maybe haven't had the results, right? So then now I'm telling you there is a medication that's available. This is what it's going to do or what it's supposed to do, how it's designed to work. And if we've never had those like really positive experiences with some of the other interventions, I think some of it also comes from that past history. So that's when
That hope.
having the
Mhm.
science behind, okay, this is how this is working in your body. And then I find typically in these situations, if patients are willing to try or are interested in trying, and a lot more are coming very informed and and really understanding how the drugs are working, I like to have them come back after a month and talk through like what's going on, how are you feeling? I've had many patients talk about this idea of like value shifting, where the cost of the medication is significant in my day-to-day budget. However, I've been able to maybe eat out less because my food noise is better controlled, when I go to a restaurant, like I've never been able to like ask for a box and take half of it home and feel good about that. And I feel so great
For
about
sure.
those choices or share.
Mhm.
One of my dear friends, like she recently started on Zepbound or started on a medication, and she was like, this has like really changed how I view like this medication is really important to me, important to my health. So it's made me kind of think about other areas of my life and maybe cutting out something that's maybe not serving me quite as well or not aligned with my goals as much at this point in my life. Again, so having those
Mhm.
open conversations, I think are really, really important. So it's not a perfect world, right? And I like to remind patients that you know, when certain drugs came out previously, like statins for cholesterol, they were not generic and they were super expensive. Do you remember? Like, I mean,
Right.
hundreds of dollars, times thousands of dollars. And so these medications, as they become more accessible and there's more supply of them, they're going to likely come down in price, but
Mhm.
it's not even about the price. It's really about the value, I think, that they perceive these medications, and helping them understand how they're working.
Yeah, I definitely I think and it's a good conversation to have with them to explore. Because I've had patients say, "Well, if it was for diabetes or heart disease or cancer or something serious, I would find a way
Mhm,
to pay for it." And it starts to reveal that, "Oh, okay. So why isn't this condition serious?" And,
mhm,
in a lot of those conversations, it really continues to reveal that part of us that's still like, "Well, but if I just tried harder, though,"
mhm,
and it's that opportunity to continue to talk about that science of weight regulation that we as providers are still working on, increasing our knowledge and understanding it of, but also helping our patients as well. Mm.
mhm. And that idea of clinical inertia, right? Like at the
Mhm.
conference we attended talking about how in certain, you know, primary care spaces that there's so much to unpack and discover and talk about. But I found it so interesting how many patients had never, their weight had never, you know, been brought forward or come up. And
Right.
so then maybe a provider brings it up and refers them, you know, to see an obesity care specialist, which we would love, which is great. But then I'm telling you, like, okay, I would recommend this medication for you and it's X dollars. And this is the first time anyone's really brought all of this forward to your attention, like that this is a, you know, chronic health issue. And so that can also be, I think, just very overwhelming. And so, you
It's
know,
a lot.
meeting patients where they're at and like trying to break down some of those barriers of, okay, you know, this might be the first time you're hearing it. Totally get that this is a lot to absorb. Let's like reflect, and maybe at your next visit we can explore this a little bit more. But in the meantime, like, what's one thing you want to work on, or what's one thing that's important to you? Always tying it back, and this is what I tell my students, always tie it back to what their values are, because
Mhm.
if we are not tied into what's important to our patients, it's we're not going to be able to help support them. And so
Yeah.
that's a key.
Yeah, we have to honor that they are the expert in their
Right.
lives, in their goals, in their experience, right? And having that, "Hey, I may be the expert in obesity care in this room, but you are the expert in your life, and so let's have a conversation and let's meet together and come up with that shared decision-making plan," and usually that's where the best outcomes come from, and remembering too, I think it's so tough. I mean, we have a hard time in our practice and in our field keeping up with all that's going on
Mhm.
in our space. And so I always want to highlight to those that may be listening that um, Natalie and I both used to be primary care providers, and we get it. There's just so much to learn and know and keep up with, and it's challenging. So if you're wondering, well, why isn't my primary care doc bringing this up to me? They probably don't know yet. They haven't been taught the additional science because this is an entire field now,
Mhm.
and as quickly as medicine is changing, it's really hard for them to keep up with the latest on everything.
I think of it like any other specialty, right? Like think about, I mean, in the physician world, right? To be a specialist in cardiology or nephrology or any of these, all the additional training that's really required to be able to do that and provide that care. In a primary care world, there's so much you have to know and be able to help support. You can't know everything about everything, right? And so I think that that's why it's a team, really a truly a team sport, because we will all and should all want to work together to help take the best care of patients we can. And so there's plenty of room on the team, and I think that just continuing to educate and support our patients, but then also working with our colleagues as well, and being a support for them as well.
What a great message to like finish up on of plenty of room on the team.
For sure.
It's a team effort and the patient being a part of that team, right? So I love it.
Exactly. They're driving the bus, as I like to tell my patients. They're driving the bus. I'm just the passenger princess, and that's how we're gonna roll in our journey together.
Oh, that's great. Well, this has been a great conversation, Natalie. Is there anything else that you want to leave with those watching that you'd like for them to know or consider?
Just that I really respect and honor my patients, our patients together, and that if you're watching this and thinking, "Oh man, like this resonates with me, or this really speaks to me," that Weight and Gold's a special place. We have providers and our whole team that really cares for our patients, and it takes courage, obviously, right, to take that next step. But if and when you're ready, we will meet you where you're at on this journey.
That's beautiful. All right, everybody. So I hope you've enjoyed this discussion. Come and see us at Weight and Gold if you're needing help on this journey. And like, share, subscribe so others around you can hear this message as well.
Thank you.